Dr. Amar Chauhan, and today I will talk about our intubation mannequin. Now, intubation is a skill which every doctor, paramedics, your nurses should be able to perform. So that is why we have designed intubation mannequin first time in India, and our endeavor will be to teach everyone, if required, then they can accomplish intubation. But before I talk about the mannequin or the procedure, I would again re-emphasize that whenever you are learning any skill, kindly please have mental visualization or mental rehearsal so that you are able to learn the skill quickly and it goes into your long-term memory. Now, what I have done for this skill, I'll just discuss. So, first of all, this is known as like the pre-workshop or pre-skill learning assignment. So what we have given, like you can see, so the skill is intubation, the pre-teaching like indication. Okay, so you can read about the indication. Then the terms likely to be used during skill learning. Familiarize yourself. This is very important. Otherwise, sometime when you go for hands-on, the instructor or the candidate they start discussing theory, which should not happen. We must concentrate on hands-on only. Okay, so what are the various terms? Like these are for the novices, okay, not for the expert. So ET tube, oral cavity, larynx, epiglottis, vallicula, vocal cord, external laryngeal manipulation, laryngoscope, videolaryngoscope, okay, ET CO2 sensor, okay, head position, sternal notch, external auditory canal. So you should familiarize yourself before you learn intubation. So these are the various equipments we have described, and this is the position which is of paramount importance. In intubation or in any other procedure, position is very, very important. Otherwise, it is likely to fail. So you must visualize something like this. This is glottis. Okay, this is uvula. So uvula leads to epiglottis and then the glottis. Just below the epiglottis is the glottis, and this is like the stellate, the bougie, laryngoscope. Of course, I'll be using video laryngoscope, and you can use video laryngoscope as direct laryngoscope also. And once you have done intubation, then you must watch in a video that the tube is going inside the trachea, and then this is the capnograph, and this is the chest X-ray. Okay, and the patient has been hooked to ventilator. So this is pre-workshop or pre-skill learning assignment we must have for every skill, because then we don't have to fumble or like start throwing simple question or terms at the instructor, which should not happen. We must devote or dedicate maximum time when we are going for workshop on hands-on. That is the purpose. Okay, so the most important, like, then again the second concept which I been talking about is micro skill. Don't learn skill as a whole, break into micro skill and then hone those micro skill and then complete the skill. So now if we talk about micro skill for intubation, the first important point is head position. Okay, so external auditory canal and the sternal notch in the same plane. This is very important. So you can put some pillow, you can put some block, whatever you want to, but the point is, so sniffing position, but everybody doesn't know what sniffing position is, and then when patient lies down it becomes again difficult. So the point is that external auditory canal and the sternal notch should be in the same plane. Now if you see this mannequin, probably this external auditory canal is on the lower side, so we need to raise the head. Okay, now positioning is one micro skill. Then when we will introduce the laryngoscope, then uvula, although it is not there, the uvula leads to epiglottis, and you have to go in the vallicula. So the vallicula is a place between the base of the tongue and the epiglottis. So you have to insert here and then lift. Then you lift the epiglottis and then you will visualize the glottis. Okay, and then you have to deliver the tube. So uvula leads to epiglottis, not only in video laryngoscopy but in direct laryngoscopy also. Always remember with micro skill. First, look at the uvula, advance a little bit, and have a look at the epiglottis, position the scope in the valvula, and then lift it, and then you will visualize the code. Okay, we will do the skill also. Okay, now Tarun will, let's see, he will perform the skill. So this is our own video laryngoscope which we have designed, and it has features which are unique to this video laryngoscope. It has, you can take photographs, you can record your procedure, okay, and you can decrease the brightness of the screen, and lot other many feature which I'll describe in other video. So now so now we have assumed, so when you are learning you must have a frictional contact. So now we have assumed that patient has optimal position. We have all the equipments which are needed and which might need. Whenever you do intubation, you must have a surgical criteria. Your plan B should be there. Must always remember this. Make it a principle. Get into your muscle memory. Whenever you do skill, what is your plan B regarding complication or your alternative if the skill is not done? Okay. So we will open the mouth. Okay. And then introduce. So now what we will do, come here. So as I told you, uvula, so show them uvula. This is the uvula. Okay. So the uvula, bring in the center, will lead to epiglottis. Little bit advanced. Just go inside. Yes. And one more thing. So first, give it to me. So when you hold the microscope, then look inside the mouth cavity where it is going. Okay. Now there are four look. First look inside the oral cavity and introduce the scope. Okay, that's two look. Then also that's first look. Look in the oral cavity and look at the screen. So now I am saying the uvula. Okay, so this is the uvula. Okay, so first look inside the oral cavity, then at the screen. Then again look inside and advance your scope. And then fourth look at the screen. Now what I see, yes, now I can optimize my position. So there are four look. So the first look is in the oral cavity when you are introduced the scope, and the second look at the screen. Okay, what are you saying? Because our aim here is to look at the uvula. And then the third look again, insert little bit further, and then fourth look is on the screen. So four look and you will accomplish the visualization of glottis. Okay, so now you take over. So again show the uvula and the epiglottis. Come, introduce in the midline. Okay, even in direct laryngoscopy, video laryngoscopy, midline approach is recommended nowadays. Okay, so go inside a little bit and just see. Okay, okay, show the glottis. So this is the glottis opening. Okay, now of course we are going for the stellate, 82 with the stellate. Bring in the middle. Show them glottis. Take it out. Give it to me. Bring the glottis in the middle. Yes. Now keep it there. Now don't hurry up. Yes. Should go. Make your 82 as hockey stick. It is going. The other person should take out the stellate. Okay. And now you have to inflate. So we have this manometer and inflate. Okay, so this is the advantage. And now no, so the gold standard is like we must have EtCO2, we must have a capnograph. That's what we are trying to do. Never believe on chest expansion. So now the EtCO2 is 40. Ambu, so now, so this is like good number of EtCO2. So that means, and there is a, see the chest rise. Show the chest rise. So it should be combination of both chest rise as well as EtCO2. But EtCO2 should be made gold standard even in India. Otherwise, we have come across cases where esophageal intubation takes place and chest rise is there. So EtCO2 has to be a gold standard. Okay. So hmm, okay. So this is the like the basics of doing intubation. So to summarize, the first important thing is mental visualization. As you do skill, keep visualizing this step ahead. Second, for this positioning, and then four look. First look in the oral cavity, then introduce the scope and look at the screen. Second, again in the oral cavity, advance the scope and look at the screen. Okay, then remember, uvula leads to epiglottis, and sometimes you see a beautiful glottis opening, but you are not able to do tube delivery. So that will come with deliberate practice. But remember all these things, and please, for patient's sake, try to procure EtCO2 portable equipment so that you are sure that you are in the trachea, you are in the right place, because you must have a good capnograph. Good capnograph means like after sixth breath, seventh or eighth breath, it should not decline. Okay, so that is the way we should be doing intubation, keeping in view patient safety and our expertise. But you need to do deliberate practice. And now this mannequin is very low cost, because I have seen mannequins are very costly, but we will try to accommodate your requirement. So of course I'll be putting this video on YouTube. So any query, please get in touch with us and do deliberate practice and master these like basic skills, the CPR, ACLS, intubation. And with that, bye bye. Thank you very much.